We're diving into a critical test in the world of pathology, the epithelial membrane antigen, or EMA test, used in immunohistochemistry. Whether you're a medical professional, a student, or just curious about this topic, this video will guide you through all the essential details. So, let's get started. Pretest information. Before undergoing an EMA test, there are a few important things you need to know. First, make sure to provide a copy of the histopathology report. This report is crucial as it gives the pathologist a detailed understanding of the tissue being examined. Next, the site of the biopsy must be clearly identified, as different tissues may present different staining patterns. Lastly, provide a comprehensive clinical history, including any relevant symptoms and prior diagnosis, to help contextualize the findings. Test specifications. Now let's talk about the specifications of the EMA test. EMA is an immunohistochemical stain that targets the epithelial membrane antigen, which is found in many types of epithelial cells. The test is commonly used to recognize the epithelial origin of poorly differentiated malignant tumors. This is particularly valuable when the cancer's tissue of origin is unclear, helping doctors to narrow down the diagnosis. Disease is associated. The EMA test is associated with a variety of diseases. It plays a crucial role in diagnosing carcinomas, including those in the breast, lung, and colon. EMA is also useful in the subtyping of Intraductal Papillary Mucinous neoplasms, IPNs, when used in conjunction with other markers like MUC2, MUC5AC, and MUC6. This helps pathologists in providing a more accurate diagnosis, which is essential for effective treatment planning. Specimen used. The specimen used for the EMA test is typically a tissue biopsy. This can be from various sites, depending on where the tumor or suspicious lesion is located. The tissue sample is then processed and prepared on slides for the staining procedure. Components included. The EMA test involves several key components. First, the tissue sample is sectioned and placed on slides. Then, the slides are treated with an antibody specific to the epithelial membrane antigen. This antibody binds to the antigen if it's present in the tissue, which is then visualized under a microscope after applying a chromogen that produces a color change. The results are interpreted by a pathologist who looks for specific staining patterns that indicate the presence of EMA. Test priority time. So, how long does it take to get the results? The turnaround time for an EMA test is typically around 7 days. This allows the laboratory enough time to process the sample, perform the staining, and have a pathologist review the results. To recap, the EMA test is invaluable for recognizing the epithelial origin of poorly differentiated tumors. It's also helpful in subtyping certain neoplasms, particularly when used alongside other markers like MUC2, MUC5AC, and MUC6. Providing accurate pre-test information, understanding the diseases it's associated with, and knowing the specifics of the test are all critical to ensuring the best possible outcomes.